eradicating noise from hospital and clinical settings, creating a therapeutic soundscape ecosystem. Hello, my name is Angela Tate, and I'm ecstatic to be here today to share with you all my final capstone project. My capstone project was driven from the desire to blend two industries together, that being healthcare and design practices. In order to do that, I had to obtain two concurrent degrees, one from the Edison College of Nursing and Health Innovation, the other Herberger Institute for Design and the Arts. Simply, my background is in the field of design, and I had the opportunity to work at some of the medical centers, such as the University of Michigan Replacement Hospital Program, Providence Hospital Heart Institute, Beaumont Hospital, Banner Thunderbird were amazing design renovation projects. However, in 2009, after I moved here as a licensed senior benefits specialist, I firsthand witnessed the challenges that our Cigna and other payers had when the healthcare reform was on the heels of coming around and changing the landscape of insurance forever. This was a very significant time for healthcare in order for them to become more innovative in order to survive. Somehow, some way, I realized the need to forge a new career and to blend healthcare, project management skills, and interior design together to make a difference in healthcare for others. What seemed impossible then is becoming possible today. So let us shift now and take a look at the health innovation project called Tonic Tunes. Now, if you were to meet me perhaps at a coffee cafe and you were asking me, what is Tonic Tunes? Well, let me tell you what it is. We are a company that will produce products that will help eradicate the unwanted sounds and noises within the healthcare industry, particular to clinical spaces and hospital settings. Let's just call this war on noise. Tonic Tune exists to tune down the unwanted soundscape of operational noises that are found in the ecosystem. By adding positive therapeutic sound frequencies back into the clinical setting in hospitals and patient rooms and treatment or outpatient centers, so that there's a perception of quietness. This is not another noise abatement program. Again, not another noise abatement program. We exist to meet those unmet needs of what noise has done to this industry by eradicating it. It has become a global noise pollution problem, a plague driven by the necessity of increased machinery, technology, equipment, building materials, and occupant activity. Meet the team, and here is our vision. We strive to make products that deliver healthcare easier, so outcomes in life become richly better. The mission: we create a culture that's entrepreneurial in terms of possessing a risk-taking spirit. We strive for the consistency to have ethical servant leadership. We approach innovation as a collective team, making ideas happen. We are around the patient innovators to uncover unmet needs. Well, folks, not too long ago, our team got together, one of our agile huddle meetings, and we started talking about this problem with the noise and how are we going to handle this and attack this strategy. And we start to ask, well, has this happened to you? Well, take a look at this. You can let me know. Oh, hi, Mom. I didn't hear the phone ring. How's it going? How's your neighbor, Nancy? Oh my gosh, she's in the hospital? Hospitals, and she's saying they're horrible places to get better. I kind of would agree with you because I was just there not too long ago to see a coworker, and two techs were pushing carts and almost ran me over. I also heard a lot of talking from clinicians and families. Oh my gosh, I'm so sorry to hear that she's in that particular um, place. What? She's going to stay 2 more days because of slow recovery? I would say it's probably because of the 86 different alarms for her heart monitor. Oh my gosh, in and around her patient room. The impact of noise in healthcare is tremendous. There is sufficient evidence that continuous noise exposure can induce hearing impairment. Let's go over this list. Not only hearing impairment, but you have hypertension, heart disease, annoyance, sleep disturbance, alter a patient's memory, increase agitation, lower pain tolerance, leading to feelings of isolation. Noise also impacts the hospital staff and employees. How? Well, their performance. Increased medical nursing errors can occur, contributes to alarm fatigue, stress and anxiety symptoms, depression, irritability, decreased concentration. Now, all of this drives reduced efficiency and decreased productivity. It simply leaves the medical team in a future state of burnt out, and never mind the patient. They continue to have poor outcomes, and this is a problem. Need I say more? The noise epidemic in hospitals recognized as a very serious and health hazard. It is more than a nuisance. So our team decided to approach this particular innovation by looking at the framework cycle. The framework consists of the problem, which you heard about, the concept, which is our solution, being able to test it and refine it, and then the implementation. This is quite an iterative process. Because this is such a problem, the Noise Control Act of 1972 was established by the EPA, or the Environmental Protection Agency. It simply states that as a national policy, it promotes an environment for all Americans to be free from noise that jeopardizes their health and welfare. Let's take a closer look at three agencies that are pretty well known within the health industry, and that being WHO, the World Health Organization, Inc., the International Noise Council, and then we just heard about the EPA. These agencies have put out guidelines around the decibels of sound levels as it relates to what's appropriate for the hospital patient rooms to not exceed more than a range of between 30 and 40 dBAs. You can see here with the graph at the bottom here, you have a vertical strong red line, and that's what's recommended. The peaks and the valleys are during different times of the day, and we're looking at hospitals and nursing homes. And you can see that they all are above, the data points are above that vertical line. So we do have a major concern here. This other chart also shows you a bar chart, and what you're seeing with the gold vertical line, that is patient room. And that is at 70 dBAs compared to the circle in magenta. That represents the guidelines at between 30 and 40. So patient rooms are almost double what is the controllable, allowable, recommended noise levels for healing and recuperation. The Tonic Tunes team actually took a deep dive to take a look at one of the patient surveys. This is a U.S. inpatient satisfaction questionnaire that usually is handed out after a patient's been discharged. It measures the patient's perspective on their care. The name of it is called the HCAP, simply means Hospital Consumer Assessment Healthcare Provider System. Now, it has 8 dimensions and 27 questions, of which one that we look at addresses during this hospital stay, how often was the area within your environment around your room quiet at night? Amazingly, what we found out is, and I just pulled these numbers a few weeks back, that the average performance is satisfaction is at 62%. I started this process with the concurrent degree 5 years ago. It was still at 50%. So maybe it has improved slightly, but we have a long way to go because only 5 states out of this survey actually score between the range of 70 and 74%. And this survey represents 4,000 of the U.S. hospital out of 6,000 in total. Our team was quickly to ascertain the concept of what was going on here. And it seemed that the concept impacted the environment, the patient, and the providers. Of course, we know that it's hard on the patients to rest in an environment that is very stressful. But there are some particular pain points that the providers are facing. And that simply is because the satisfaction survey is tied to the reimbursables, they are not getting that as much as they should. Also, because of the discomfort and the inability for the patient to rest or complete their treatments, there is the problem of compliance, adherence, and last but least, many of the patients and studies that we looked at, we are finding there are premature discharges and admissions. These are the 4 pain points the providers are suffering with. Tonic Tune clearly sees that the solution is to disseminate sound frequencies hertz back into the clinical setting that provides a sensory perception of quietness through the hospital soundscape ecosystem. Our IP is how the therapeutic soundscape ecosystem solution is going to be packaged. It's a layering process of three different key areas: wearables, the building structure, like the HVAC system, operational noise can be minimized and replaced with sound frequency sounds. And then being able to develop an electronic sound frequency pad that will lay on the patient bed or the exam table or surgical table or on the chair. These environments are going to impact the environment and the positive outcomes and measures for the provider. Let's take a look at our IT solution too, as this would need to be implemented. And that is that there's an application system strategy where we would partner with the clinical information research developer. Our goal is to capture the sound frequency hertz that will create a positive outcome specific to that patient unit and their condition. By isolating the hertz sound frequency, we will be able to link it and look at that relationship between the discharge readmissions metrics as well as the patient satisfaction scores and adherence. To achieve this, it will require that partnership with the CRD and also to adopt the software as a service to tie it also not only to our hertz software, but also to the electronic health records. What was a pain point for the providers is a thing of the past. Increased compliance adherence will occur, as well as satisfaction scores, and also reimbursement and readmission premature discharges will decrease. This has been validated by evidence-based studies that our team took the time to look at, as well as we created our own tests and refinement and even customer service satisfaction survey to make sure what we were looking at really was valid. One of the studies we looked at was quite recent, 2021, speaks to the biomarker for noise and noise induced in heart patients, morbidity and mortality. And this also how it impacts the ICU with the length of stay, their inability to rest, readmissions. Chronic noise exposure also impacts mental disorders, depression, and anxiety. You'll see on the slide here how it has caused ICU patients in hospitals 14,000.7 per patient. We also looked and did our own study. We worked with the military and were able to get some of the soldiers to try this technique, and during their treatment time. One of the soldiers actually fell asleep. We were able to take their feedback from the type of prototype we should design, and we incorporated that and also quantified that through our own survey, customer service survey. And this was able to help us understand exactly what it was that people said they were willing to buy and use. This is so important because the stats show us here that there are over 6,000 U.S. hospitals and 919,000 staffed beds. That's quite a bit in the marketplace. In addition to that, we learned some more about the fact that our test market seems to be surprisingly recommended from the survey to be the dental market, which could be the MVP, or after that, we can move into the emergency department and urgent care area and offer consulting services as well. We had an opportunity to meet with some investors as well who are very interested in seeing and learning more how they could help us. We were able to share with them some more numbers of how healthy the wellness sound market was, as you can see here, and also being able to tell them that we would need some capital to get started with our implementation in order to be able to fulfill this goal. We believe that policy is important, just like there's policies for solar panels and emissions tax credits that can happen also in the healthcare industry for noise.